Yes. All right. So our president, action.
I'm Kimberly Kelly, and as president of the Ventura County Alumnae Chapter of Delta Sigma Theta Sorority Incorporated, we bring you this public service announcement to say that we recognize December 1st as World AIDS Day, and we commit to supporting its relevance and importance. VCAC is joining in to collectively remind the public and government that HIV/AIDS has not gone away, and that there's still a vital need to increase awareness, continue research, fight prejudice, and improve education about the disease. In an effort to educate and expand our knowledge regarding HIV and AIDS, a few of our chapter members will now bring you some facts about HIV and AIDS.
I'm Marty Reynolds, Chair of International Awareness and Involvement. The theme for World AIDS Day this year is Ending the HIV/AIDS Epidemic, Resilience and Impact. The 2020 theme focuses on the global commitment to deliver quality, people-centered HIV prevention and treatment services for impact. The theme also speaks to strengthening the capacity and resilience of communities and health systems to address HIV prevention services in the midst of a global pandemic. While COVID-19 has created major new challenges, the Ventura County Alumnae Chapter of Delta Sigma Theta Incorporated support the U.S. Department of Health and Human Services and its partners in remaining committed to accelerating efforts to end the HIV/AIDS epidemic.
I'm Helene Stallion, co-chair of Social Action. Between 2000 and 2019, new HIV infections fell by 39%, and HIV-related deaths fell by 51%, with 15.3 million lives saved due to the antiretroviral therapy. This achievement was the result of great efforts by national HIV programs supported by civil society and international development partners. Join us in standing up against HIV-related stigmas and discrimination by listening to the people living with HIV, educating yourself and others, and speaking out against stereotypes.
I'm Kathy Agnew. Acquired immune deficient syndrome, AIDS, is a term that applies to the most advanced stages of HIV infection.
Humphrey Anthony. There are an estimated 38 million people living with HIV at the end of 2019.
I'm Crystal Brooks. Adolescent girls and young women in Southern and Eastern Africa and Indigenous people in some communities may be particularly vulnerable at increased risk of HIV infection.
I'm Kamiska Fonts. HIV continues to be a major global public health issue, having claimed almost 33 million lives so far.
I'm Kelly Owens. Approximately 1/4 of people with HIV in the United States are female, according to the CDC, and most were exposed to the virus through heterosexual sex. A woman who is pregnant and has HIV or AIDS can pass HIV to her unborn children during pregnancy. She can also transmit the virus during childbirth and when breastfeeding.
I am Lakeisha White, co-chair of Social Action. HIV can be diagnosed through rapid diagnostic tests that can provide same-day results. HIV self-tests are increasingly available and provide an effective and acceptable alternative way to increase access to people who are not reached for HIV testing through facility-based services. These rapid tests and self-tests have greatly facilitated diagnosis and linkage with HIV treatment and care. There is no cure for the HIV infection. However, effective antiretroviral drugs can control the virus and help prevent onward transmission to other people. At the end of 2019, an estimated 81% of people living with HIV knew their status. 67% were receiving antiretroviral therapy, and 59% had achieved suppression of the HIV virus with no risk of infecting others. As a leader in the community, we hope that our public service announcement has expanded your knowledge and sensitivity towards HIV/AIDS, and we ask you to join us in supporting the efforts to end this epidemic.